I was just 18 years old when towards the end of the year, I started feeling my lymph nodes hurt. I didn't take it that seriously, but it got to the point where all of a sudden, I started feeling really, really bad. I stopped eating, and even at one point, it was hard for me to breathe. Everything went downhill very, very quickly. When they told me I had leukemia, it was just a shock at first. It took me time to really understand what I was about to go through. You just have this feeling that you're about to go to war to save your life.
This is Hani Levy. When she was just a teenager, she was diagnosed with advanced blood cancer.
I think that only later on, you begin to understand that there are two issues here. There's the issue of how to survive, and the issue of what life will be like afterwards, how your life will be.
Because Hani's diagnosis was so aggressive, doctors told her that she would immediately have to begin several rounds of chemo, which could have devastating side effects for the future.
When I understood that the cancer treatment could hurt my fertility and that there was a chance that I couldn't be able to have kids, it was very hard. Your ability to have children is part of your health. It's part of your femininity. For me, having children and having a family was the most important thing in the world, and it was very scary for me to think that I might not be able to have that.
Until now, cancer patients struggling from advanced stages of the disease have faced a much harder path to becoming parents. That's because most patients have only had the option of going through traditional fertility treatments like egg freezing, which can take months and require postponing treatment. But for patients like Hani, who are very sick and must start chemo or radiation therapy immediately, there just isn't enough time. And the same issue exists for children who have been diagnosed with cancer before they even start ovulating. Luckily, when Hani found out that she had leukemia back in 2002, doctors in Israel were already in the process of developing a revolutionary treatment to change that.
I have several cases that patients came to me and told me, we will not start chemotherapy if you will not preserve our future fertility. Patients, they are looking for the hope. And when we give them this hope, it's like creating a new world for them.
This is Dr. Dror Meirov. He's the head of Sheba's Fertility Preservation Center. And he's known as one of the pioneers of one of the most groundbreaking fertility treatments in the world: ovarian tissue cryopreservation. This procedure involves removing a part of a patient's ovary tissue through a keyhole surgery before she's undergone chemotherapy. Doctors then slice the ovarian tissue into many tiny pieces and freeze them in special containers in a lab.
We freeze ovarian tissue from the age of 1 year old babies until the age of 40 for patients who are just close to the cliff and might lose their fertility in 1 week, 2 weeks when they start the sterilizing treatment.
When a woman has completed her cancer treatment, the tissue can be defrosted and inserted back into her abdomen when and if she decides she wants to have children.
The follicle that exists in the tissue starts to grow. She starts to have a hormonal secretion, ovulate, and then she conceives either naturally or by IVF.
In 2005, the first ever ovarian tissue reimplantation was carried out in the world with massive success. And almost 2 decades later, this procedure has changed the lives of hundreds of cancer patients. Some patients can conceive at least 3 children with just 1 transplant, since ovarian tissue can last for up to 10 years. In 2015, Hani became the first leukemia patient in the world to undergo the procedure.
After the transplant, it took 5 months until I started getting my period again, and that was something unbelievable, because I hadn't had a period for 10 years since I had survived cancer. And just a month after that, we started going through the IVF process. It took 4 rounds of IVF until I was pregnant, which was at the end of the day very fast.
The success rate of this procedure is remarkable. 95% of patients recover their hormone function, 50% conceive a child, and 41% have had at least 1 baby. And as a single hospital, Sheba Medical Center has carried out the highest number of operations in the world. Today, after 2 different ovarian tissue reimplantation surgeries, Hani has 3 beautiful sons. And she's in the process of trying for a 4th child.
As the years have gone on, I have met women who were never able to have children, but if they had gone through the surgery when they were going through cancer, they may have held a chance. So I hope that this surgery is offered to every woman who goes through cancer today. I think it's a step that actually helps with the recovery, because having a hope and a fantasy after your recovery is something that is so important.
על השנים שאחרי.